I'm Dr. David Fletcher, the CEO and founder of CLA. Now, one of the most important things that I'd like to share today is what we call Centric table talk. This is such an important point in learning how to master communication. You have this unbelievable time with the patient when you and the patient are just together at tableside. And so when you learn to master this particular aspect of your communication skills, it can elevate your excellence both clinically and in the way in which you want to inspire that patient. There are three distinct strategies that I want to focus on today as we grow this. Number one is that you need to have present time consciousness to really drill in this laser focus. And number two, we need to be able to instantly confirm positive change. And finally, we need to inspire confidence. And this is what really matters. So let's dig in on number one, which is the first strategy, which is present time consciousness. So what do we mean by that? Well, we mean that you are there in that moment. We need to laser focus in on what matters. And you know how that usually begins? Big ear. Listen to them. Listen and help them know that you're hearing and listening, both with these hands and with these ears, everything that matters for them. We have to change the narrative that's in their perspective and that has been embedded with them forever. So I created this lovely little 6-word syntax that I'd like to share with you. Most people are conditioned to think about their healthcare in this way. They have to feel better, they have to get well, and they have to stay alive. But you know, there's a different way in which we as chiropractors can shuffle those 6 words and get a much more inspiring outcome for it. In fact, we'd like them to get better. That really matters. In fact, we'd like them not only to get better, but stay well. And get this, the final complex of this whole 6-word syntax is feel alive. And so instead of asking patients, how do you feel or how are you? What if we change the narrative tableside to say, what's different? Your role is to be a neurological programmer instead of a spinal mechanic, and you take on that nerve-first approach. What we know more than anything is that it gives you the power, tableside in your conversations, to really focus on that difference. You know what's different? They're changeable. Their nervous system is able to adapt. Everybody loves this idea of changeability, which brings us to the second strategy, which is in confirming positive change. And this is where using objective data and real data, which is their personalized data, it brings it so importantly in front of them. And that's where insight scans really shine. Instead of saying, oh, your back pain is getting better, we could look at our data and say to them, listen, I'm so proud of the fact that your nervous system is on fire, and on fire in a good way. It's changing all the time. In fact, when you first came in, your core score was a 68, but now it's a 74. That means that you're so much more efficient, and that means that if we stay focused on this care plan, you're going to continue to grow from 68 to 74, and our goal is to get you up and above 80, because that's the magic number that allows us to know that your body and your nervous system are in a very stable state. We can make progress visible, which is critical for that. And finally, we reach into strategy number 3, which is inspiring confidence. And listen, I want to let you know that this confidence is so important for not only the patient, but for you and your practice. I'll tell you what it really means. Certainty pays big. And so one of the things that we have to really hammer home in this whole idea of why we do what we do is that the certainty allows the patient to feel inspired and to let them know that they're with the right practitioner and spending their time and their energy appropriately. And that certainty is driven by objective data. And objective data about their nervous system is the key to this idea that they can live a longer, healthier, and happier life. Now, everyone loves to hear good news, and that's so important. And that's one of the reasons that Insight scans are your ally when giving this great news to your patient. Why? Because when I use the Insight, it allows me to focus on the nervous system. And I can use that objective data to show my patients right away the changes that I clinically am seeing. This is so important because it brings them into this conversation that isn't just about the generalities of health and the healing process. This is truly about them. I can report those objective findings directly to them. And you know that the Insight through its Synapse software offers 20 different report combinations. That means that I can customize my relationship with that patient and their nervous system however I like. So think of your table talk as an extension of your data. The truth is that Certainty pays big in retention, in attraction, and in their ability to absolutely refer not only their family, but also their friends and their coworkers. So this is why we really have this opportunity to say, you know, what we talked about, which is to move them from this idea of feeling better to getting better, getting them to staying alive to feeling alive. That's the joy we have when we take on this role of present time consciousness, of allowing us to pass on some fabulous information to them and inspiring that confidence. As you shift your words, you shift your practice. So I think you're starting to understand the importance of this tableside and scan-centric table talk. I want to challenge you to start to apply these 3 strategies. It will make an enormous difference in your confidence as well as the confidence of your patient. Now, if you like what you've heard, we have an ebook on this exact topic. And if you'd like to learn more, let's get you in touch with an Insight advisor. Be sure to reach out. We love to chat with you about all of the things that Insight can do for you.